Getting a breast cancer diagnosis is a scary thing, but there are critical steps people can take for a successful recovery. Mallory Mark is a physical therapist at the Atlanta-based nonprofit TurningPoint Breast Cancer Rehabilitation, and she's here to share how patients can manage that long road to recovery. Mallory, thank you so much for joining us.
Yes, thank you so much for having me, Sasha. I'm happy to be here.
Happy to have you here. So tell us, what are the most essential things any breast cancer patient can do to feel better, faster, and get back to somewhat of a normal life?
That's a great question. So honestly, first and foremost, the biggest thing would be advocating to your medical provider that you are having some sort of physical impairment. We know that a majority of patients at some point along their treatment continuum are going to have some sort of physical impairment that could benefit from rehab. So really verbalizing that to your doctor. And then, once you're hopefully within a rehab program or given some sort of, stretch and strengthen program, consistency is key because things are a bit different after surgery and diagnosis and all the treatments and how that really impacts your body. So consistency is key in maintaining the gains that you make with rehab and your own program that you have.
I'm sure it's easier said than done, but probably a positive attitude as well. And what kind of regimen do you need to maintain to make progress and overcome breast cancer?
Yeah, that's a great question. So there are definitely some certain guidelines that are put out by the American Cancer Society. One of those being some regular aerobic activity, whether it's walking, jogging, whatever it is that you like to do. And then some sort of strengthening about 3-4 days a week, and then flexibility on most days. So those are kind of general guidelines. Ideally, someone like myself or another therapist would help kind of guide and tailor to each patient's specific needs because everybody's different. It's certainly not a black and white approach. Everybody's treatment protocol is different, how it affects their body is different. So really having that rehab professional is critical so that we can hopefully guide and tailor your journey back to some sort of normalcy.
Yeah, and then 2020, we have COVID now, and since cancer patients have compromised immune systems, and we kept on hearing, taking care of these people, how did COVID impact the way you worked with your patients over the last 9 months?
Yes, so when all of this hit in about, I guess it's almost been a year now, in March of 2020, we went completely virtual. So we switched to a telerehabilitation program, and then we were seeing patients actually like this on a HIPAA compliant Zoom platform. We were able to complete all of their initial evaluations, all their follow-up visits, and then we stayed that way for a couple months while things were still pretty crazy. And then from there, we slowly started to inch back in towards the clinic, but it was totally different. I mean, the way we were seeing people, of course, all the protocols in place that we need to because patient and staff safety is of the utmost importance to us. Like you said, everybody is to some degree immunocompromised. So we wanted to make sure that we had all those steps in place. And now it's pretty unique. We're able to offer patients kind of a hybrid approach. So if you don't feel comfortable at home, totally understandable, or you're in the throes of chemo and your counts are really low and leaving your home just isn't safe right now, we are able to see you safely and efficiently, completely virtually, or some patients are doing kind of a hybrid model where we do a few in the clinic and then virtually. So we're able to meet your needs as best we possibly can.
Well, it's very cool that you're making such a positive impact in these people's lives. And I know there's nothing like the human touch, but hopefully we'll be back to that later. Mallory, thank you so much for joining us. We really appreciate that.
Thank you for having me. I appreciate it.